TAU targeting immunotherapy for Alzheimer's disease. Background. Alzheimer's is the most common cause of dementia. It causes around 60% of dementia cases. It is most commonly caused by the buildup of amyloid plaques in TAU or neurofibrillary tangles. These plaques and tangles lead to brain atrophy or brain shrinkage, and narrower gyri, which are brain ridges. As the gyri get narrower, the sulci, or spaces between the ridges, widen, and the ventricles, which are fluid-filled cavities, get larger. Amyloid plaques. APP, or amyloid precursor protein, helps with neuron growth and repair. It gets used, broken down, and recycled. In a normal cell, APP is broken down by an enzyme called alpha and one called gamma. This creates soluble waste. As you can see in the image, APP is broken down by alpha and gamma secretase, and you can see the two small insoluble pieces. When someone has Alzheimer's, however, they produce another enzyme called beta secretase that acts instead of alpha secretase. And this acts together with gamma secretase to break down APP. The leftover fragments, a monomer called amyloid beta, are not soluble. Amyloid beta is chemically sticky, meaning it tends to bond with itself on the outside of neurons, and this causes plaques to build up. These amyloid beta plaques get between neurons and disrupt signaling, leaving brain function impaired. They can also cause inflammation, damage to surrounding neurons, and increased risk of hemorrhage or blood loss. This all happens outside of the cell. What is TAU? Cells, in this case neurons, are held together by the cytoskeleton, which is made up of microtubules. These microtubules are track-like structures that ship nutrients through the cell. TAU is the protein that ensures that the microtubules don't fall apart. TAU tangles. In the brain of someone with Alzheimer's, beta amyloid plaques initiate pathways in the neuron that lead to activation of kinase. Kinase is an enzyme that transfers phosphate groups to the TAU protein. This causes proteins to change shape, stop supporting microtubules, and clump up or get tangled with other TAU proteins. This leads to the formation of neurofibrillary tangles. Tangles and non-functioning microtubules result in neurons that can't signal well, and they end up going through apoptosis, or programmed cell death. How Postdyne-mab works. Postdyne-mab floats through the brain's extracellular space and looks for TAU proteins that have begun to form tangles. When it finds these TAU proteins, Postdyne-mab binds to them, and it acts as a bright flag, bringing attention to them. This tagging process makes it easy for the brain's microglia, or immune cells, to see it. These microglia swallow the tagged TAU and break it down in the lysosomes. This process helps by stopping TAU from spreading to healthy neurons, preventing tangles from forming, keeping communication lines open between neurons, and potentially slowing neurodegeneration. Research question. Can Postdyne-mab, a TAU-targeting antibody, reduce neurofibrillary tangles in the brain and slow cognitive decline in Alzheimer's patients? Research goal. The goal of this research is to evaluate the potential of Postdyne-mab in breaking apart TAU tangles. This will lead to slower disease progression for Alzheimer's patients. Hypothesis. Postdyne-mab can reduce extracellular TAU levels, inhibit tangle formation between neurons, and overall slow neurodegeneration in patients with Alzheimer's disease. The research method used was a randomized, double-blind, placebo-controlled study, and as you can see to the right are the clinical outcome measures. Some biomarker-based methods, plasma PTAU prescreening by TAU PET imaging was used, and participant selection was done by an early Alzheimer's disease confirmation via TAU PET scan. Research findings. High-dose groups showed up to 35 or 40% reduction in faulty TAU by week 36. Low-dose groups showed 20 to 25% reduction. It's worth noting that data from Phase 2b has not been released yet, so this is all data from Phase 1. Postdyne-mab was shown to have penetrated the blood-brain barrier. No serious adverse events relating to the drug occurred, no dose-limiting toxicities were found, and a low incidence of anti-drug antibodies were found. Summary. Patients with Alzheimer's disease experience cognitive decline due to not only amyloid plaques but also neurofibrillary tangles made of TAU. Results show that post-Steinmab was proven to be effective in reducing TAU tangles in the brain, therefore slowing neurodegeneration. Conclusion. Post-Steinmab's path is the first step in a new therapeutic approach to treating Alzheimer's. It not only shows the disease but is able to intervene earlier. Research is still ongoing, and Phase 2 of this trial will further test post-Steinmab.